Terry, while there is no nationwide lockdown, most of the country is living under restrictions. Almost all the major cities are seeing a total lockdown, and many other districts are also seeing either a full or a partial lockdown. So, this hesitation to impose a national lockdown is being criticized still because the need to break the chain of transmission is still prevalent. Now, rural India is facing the scourge of the coronavirus, suffering even more so because many cases can't even be diagnosed, let alone treated, because of a lack of healthcare infrastructure, and both vaccines as well as following of restrictions in these areas is limited right now, which is why there are such calls. However, last year's national lockdown was extremely unpopular, and there is analysis that perhaps the hesitation of the Narendra Modi government to impose another one rests on this fact. Unfortunately, Terry, quite the opposite. India has seen a serious dip in vaccinations at the highest levels. It had crossed over 4 million doses a day, but right now in this month, it has averaged below 2 million doses. And when this month has actually seen the expansion of the vaccination drive to everybody above the age of 18. Now, there are multiple reasons around this. The scarcity of vaccines is, of course, a predominant one. The states have now been handed the responsibility to carry out at least half of these vaccinations by procuring doses from the manufacturers directly. But another major factor could be vaccine hesitancy. Many in rural India are looking at rumors saying that they could get ill after receiving the vaccine and are hesitating in getting it. Well, the WHO has said, Terry, that this variant is more transmissible, and this is one of the criteria that makes a variant of concern. Some of the others are still being researched and processed for this variant, which is, does it evade antibodies? Does it not have as neutralizing an impact? Or does it evade vaccine? Now, all of this will, of course, increase concerns around this vaccine. There is a belief that the current surge in India could have been fueled by this variant. While scientists right now say that the vaccine is effective, there is also expert opinion that the vaccine design may have to be modified if it is found that these variants that the vaccines do not work as well against such variants.